Today I wanted to talk to you about injuries. So obviously been a mountain biker, nearly all of us will have had an accident, which has meant we won't be able to get on the bike for a little bit. We might miss getting outdoors, and obviously looking after our physical and mental health during that time is really important. The one thing I really wanted to focus on with you is we all know about rehabilitation. So after an accident or injury, we might seek medical help, physio, sports therapists, even surgery, and we'll be directed or advised to follow certain exercises, movement patterns to get ourselves going again, and that's really important. But the big thing over the past 5 or 10 years now has been prehabilitation. So what we do with our bodies, our joints and our muscles before the incident. So there's a lot of evidence out there now. The better condition our bodies are in, the less harmful or catastrophic the injuries can be, but also we recover quicker. So making sure you're following a good gym routine, which consists of balance exercises, stabilization, strength exercises, power exercises, will really put you in a good place to hopefully bounce back quicker or not experience such catastrophic trauma to the body. A couple of our most vulnerable body parts are obviously the shoulders, the collarbone, etc., and then the wrists. To strengthen our wrists, good exercises, any grip-based exercises, rows, dead hangs, really good. And then for your shoulders, obviously you want to be focusing on the rotator cuff exercises, looking at internal and external rotation. Some of these and a lot of these are very simple to do. Bands are good for it, and you don't need to be in a gym if that's not your thing. But the evidence is out there and it grows every day. The stronger we are, the better the length tension relationship with our muscles, range of motion in our joints will dramatically reduce the risk of serious injury and help a faster recovery. If you have picked up an injury, it doesn't always mean you have to sit there and you can't do anything. If it's a lower body injury, you still may be able to work the upper body, and vice versa. Some injuries might be a bit more serious and restrictive, so you still might be able to then do some easy mobility at home, or yoga. You might still be able to get out for a nice walk and get some of that outdoor therapy and keep the body moving, get the blood circulating, joints moving, and help aid that recovery. Always listen to medical advice though, as those guys will have the exact information for your injury and your recovery. If you have been off the bike or not been able to train in the gym or at home for a while because of an injury, then give yourself a break when you get back to it. Don't get into that negative mindset of where you were a month ago, 2 months, 6 months ago, whatever that recovery time is. Just get out there, be grateful you're back on the bike, enjoy it, have some fun, and just make sure you keep reminding yourself that you're probably still streaks ahead of where you were 5 years ago, and it will come back.